An urgent call for action from the front lines of Canadian healthcare. Unions representing 70,000 hospital workers in Ontario say their members are overworked, exhausted, and need help. Staffing issues are forcing some emergency rooms to close for hours, even days. The unions blame both the provincial government, and the executives who are running the hospitals.
Things are rotten in the state of our hospitals.
We are alarmed that to date we have seen no sense of urgency from the provincial government in the face of an unprecedented threat to our communities.
PSWs, porters, nurses, all of us were treated like cattle, and the people running our hospitals are driving us into the ground and away from the bedside.
In response, a spokesperson for Ontario's health minister says, in part, building on the over 10,000 healthcare workers added to the system since the start of the pandemic, we are investing in a range of initiatives to attract, train, and retain more nurses and get them into the system sooner. We want to get some more perspective, though, on all of these issues from Dr. Katharine Smart. She's the president of the Canadian Medical Association. She's with us from Kelowna, BC. Hi, Dr. Smart. Good to have you back on the program. Thank you for making the time.
Thanks for having me.
I certainly want to get to some of the back and forth in a moment. But first, I think a lot of Canadians right now are reading stories on news websites like the CBC or hearing stories from their own family members about kind of anecdotal evidence of almost like a crisis in emergency rooms across this country. Can you qualify some of that for us? Is this because of COVID or is it something else?
I think it's really a combination of so many factors. And I think crisis is the right word. We're seeing closures across the country, but even the departments that are operational are really struggling to see patients in a timely way. We're seeing unprecedented wait times. We're seeing unprecedented numbers of patients boarding in the emergency department because they can't move into the hospital, which is, of course, in turn, delaying the ability to care for people that are there. We're even seeing major hospitals ask lower acuity patients not to come because they're so overwhelmed. So this is really, I think, just the scope of it is something we haven't seen before. And it's really impacting the ability of healthcare providers to give patients the care that they want to. And I think it's become very, very scary, actually, when you think about what this means for the quality of care we're able to deliver right now.
Can you help us further contextualize when you say, this hasn't been seen before? I was interviewing the health minister from British Columbia yesterday who said, on the whole, and I'm paraphrasing, but he kind of described access to the system, to the ER system as adequate, but then said, there are definitely areas in the province, places in the province where that isn't the case, and we're very concerned about that. Like, is this isolated to certain areas of various provinces, more rural areas, for example, or is this more widespread than that?
I think this is part of the challenge we're having right now in this conversation is really it's around language. And I think it's around having the government really acknowledge what's going on. My own opinion is I don't think it is adequate when people are waiting 12, 14, 16 hours to see an emergency physician. There's closures of departments. Elderly people are waiting for days on beds and hallways. There's no paramedics to respond to people. I mean, to me, this is not an adequate healthcare system. Are you eventually getting care? Yes. Is that what Canadians expect? Is that what we want to deliver as providers? I would say no. And I think this is partly why you're hearing so much moral distress from providers is this disconnect of their lived experience on the front line and the narrative that's being put through by our political leaders and sometimes administration. And it's just not reflective of what's actually happening on the ground. I think, part of the solution here is getting on the same page and being transparent and acknowledging that we are in a crisis. No one's saying there's easy solutions, but if we're at least on the same page, we can start to have the right talks.
Well, I did want to ask you because you met with premiers, right? And there was this whole back and forth last week between the premiers and the federal government around funding and Canada Health transfers and a whole lot of stuff that we as the political show cover. But you met with the premiers, and I wonder, A, are you convinced that they are seized with the severity of this? And B, do you think there is a willingness, or do you sense there is a willingness on their part to actually seek those solutions?
I think they are starting to realize just how dire it is. I mean, I think that message is very clear, and I think they're hearing it from professionals in the system. They're hearing it from constituents. And I think we saw that reflected in the press conference after their meeting, that there was a lot of dialogue about healthcare and a lot of recognition that this is a problem. But I think that the challenge we're at is we keep having the same circular conversation about kind of who needs to do what to fix it and blaming people rather than really committing to moving forward together. I mean, this solution needs to be collaborative. It needs to involve people on the front lines, the health professionals. It needs to involve all levels of government. We need to map out what needs to happen, and we need to start walking down that path. You know, the political finger pointing has gotten us where we are today, and it's not going to get us through this crisis.
Or to what extent is the staffing shortages at the crux of a lot of what's happening?
It's a huge part of the problem. We absolutely have a human health resource crisis on our hands. It's very acute and it's getting worse. You know, when you look at some of the statistics, the amount of vacancies for nurses and other allied healthcare professionals has almost doubled in the last few years. We've got huge numbers of people that are no longer in the system that could be in the system because we haven't retained them. We're seeing, you know, a huge loss of family doctors. So we're just bleeding healthcare professionals. And I think the reason for that is because the system is so fundamentally broken. It is just destroying people when they're working in it. So people are leaving and they're doing other things. If we don't address that the system itself is at the root cause of why we're seeing this profound burnout, why we're seeing attrition, why we're not able to attract or retain healthcare workers, we're never going to solve this problem, because the healthcare system is the people in it that deliver the care to patients. And those people's well-being needs to be prioritized. They need to be able to work in a functional system. And until we elevate that conversation, I don't think we're going to solve that problem.
Where doctors are specifically concerned, and in particular, I heard you talk about primary care doctors, which we know, a number of Canadians are without right now, and where the system is concerned as well. Is there pause within, the people you represent to kind of take a second look at the way in which licensing for example, for doctors who come from other countries here? I think I had read one statistic that as of late last fall, there were about 13,000 internationally trained doctors in Canada not working as doctors. That comes from the Internationally Trained Physicians Access Coalition. But I know I've spoken to so many of them who have called when we cover stories like this and said, hey, part of the problem is I've come here from England and it's next to impossible for me to get certified. I know that's governed by regulatory bodies provincially, but is there a role for the CMA to take a second look and say maybe this part of the system also isn't working?
We've absolutely been advancing that issue to government as well and been calling for them. Again, this is part of our dialogue around trying to reduce regulatory barriers between provinces and territories, and seeing some federal leadership in that space is absolutely the recognition that right now, the way we assess, credential, and bring internationally trained physicians into our system is also not working. It's stuck in, a lot of bureaucracy, a lot of regulatory barriers, as well as a lack of support for those physicians to make it practical for them to go through the steps in the system. So there's a ton of work that could be done there to improve that, particularly for people, as you described, that have already moved to Canada, are already living here, could be in our system and aren't.
And so just before I let you go, I feel like it's a very frustrating thing for Canadians to listen to. It's really disheartening to keep hearing over and over again how broken the system is and how, there isn't a lot of hope right now for them. If you're talking about solutions, when we say the system's broken, it's such a big thing to say. Are there tangible things that you could, for example, see some of the premiers in this country pursue in the short term, not over the next 10 years, in the short term, that could tangibly make a difference?
Absolutely. I think the first step is building a sense that we're all in the same team and we're moving in the same direction. I think never underestimate the importance of the people that you need to work for you to believe in your vision and to bring them on board, listen to them, and start changing that culture. That commitment would go a huge way. I think there's absolutely changes in primary care reform that could happen quickly around how we support family doctors that could, again, retain and encourage more people to return to that longitudinal care. We could start resourcing our human health resources differently. We could start planning. We could start improving workplace culture to retain the people that we have. And there's things like national physician licensure that would allow flexibility, support for colleagues in rural areas, allow us to scale virtual care by not having those regulatory barriers between provinces and territories. That also is something that could be achieved over several months. So I think there's several targeted areas where we could see results more quickly. Of course, there's also those really bigger systems issues, but I think there are some quick wins. It's just a matter of having the will to move forward.
Okay, Dr. Smart, I'll leave it there. Thank you very much for your time.
Thanks for having me.
Dr. Katharine Smart is president of the Canadian Medical Association. Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.